Hello, my name is Dr. Carissa Marie Baker-Smith, and I would like to present to you our work entitled The Impact of Social Determinants and Digital Health Literacy on Telehealth Acceptance for Pediatric Cardiology Care during the early phase of the COVID-19 pandemic. Our work is the product of ACCEL, Delaware ACCEL Rapid COVID-19 Grant Funding. Children with congenital heart disease and other chronic health conditions are the most vulnerable to poor outcomes without appropriate care. During the early phase of the COVID-19 pandemic, pediatric cardiology visits at Nemours Cardiac Center at the Alfred I. DuPont Hospital for Children in Wilmington, Delaware, were transitioned from traditional face-to-face patient-provider healthcare delivery encounters to a virtual telehealth platform. Unknown is the impact of social determinants of health, including but not limited to residential environment and poverty status, race, ethnicity, and language, as well as digital health literacy of the parent or guardian on telehealth acceptance for pediatric cardiology care during the early phase of the pandemic. Our hypothesis is that social determinants such as race, ethnicity, poverty status, and language, as well as type of visit, new versus follow-up, primary cardiac diagnosis of the child, and the digital health literacy of the parent or guardian influences acceptance of telehealth by parents during the early phase of the COVID-19 pandemic. Our specific aims are, one, to examine the impact of socio-demographic factors as well as cardiac disease and the type of disease on the acceptance of the telehealth visit for pediatric cardiology patients during the early phase of the pandemic. Aim 2 was to evaluate parent perceptions of telehealth technology usability during the early phase of the pandemic. Our methods and results are as follows. We obtained IRB approval for our study. Consent for participation in the study was secured via REDCap. Distribution of the surveys were through the REDCap and email links using English and Spanish translations of 2 surveys. One was the Technological Ease and Computer-Based Habits Inventory Survey that assessed digital health literacy, and the second, for those who completed telehealth visits, they received a link to the Telehealth Usability Questionnaire. Surveys, again, were administered as a link through REDCap. However, for any parents who did not feel comfortable completing the surveys electronically, printed copies of the consent as well as the surveys were distributed by postal service. During months 2 and 4 of our project, we collected survey data as well as data regarding each patient who had been scheduled between the dates of March 30th and May 8th, 2020, at Nemours AI DuPont, Wilmington, Delaware, and data from the electronic health record was extracted and included into a database, a secured database that was password protected. All analyses were carried out using SAS 9.4, a statistical software package from Chapel Hill, North Carolina. During months 5 through 7 and the present, we have presented our data both at the Nemours Cardiac Center Research Day as well as internal research meetings for the ACCEL program. One project is currently in submission form and ready for submission to one of the top journals, and we've submitted 3 abstracts for upcoming meetings, national meetings. 2 other projects are currently in preparation for publication. Our results showed that the majority of patients of the 849 patients who originally scheduled for telehealth visits during the early phase of the pandemic, in-person visits during the early phase of the pandemic, that 441 or 52% accepted telehealth visits. Socio-demographic factors that were significantly associated with this selection of telehealth included, but were not limited to, Hispanic ethnicity, non-Christian faith, as well as most individuals had public insurance. Interestingly, the patients who selected telehealth were primarily out of state. The patients who selected telehealth were new patients with a diagnosis of an abnormal rhythm or abnormal EKG that had been previously obtained, dyslipidemia, and acquired heart disease. There was also significant showing of amongst patients who had dysautonomia or dizziness with orthostatic stress. Additional results showed that of those who selected telehealth visits among the survey completers, which were largely white, Christian, English-speaking, privately insured individuals, that the technology view that technology is helpful, which was our Techie 10 question, and also here in the blue, those who felt that I regularly use Skype or another video conferencing service, those individuals were more likely to accept telehealth care. We carried out logistic regression and the completion of a ROC curve for determining the multivariable analysis and looking at the additional factors contributing to selection of telehealth. We found that younger age, as mentioned, the diagnoses as previously discussed, follow-up visits versus new visits, were more likely to be, new visits were more likely to be associated with telehealth selection. And then if you invert the odds ratio here, you'll see that there was a significant relationship and that it was in favor of new visits versus follow-up visits, Hispanic ethnicity, and similarly, out-of-state individuals were more likely to accept telehealth. Telehealth usability was considered high, and patients had a good interaction, with the exception that there were some concerns about the reliability of the interface, but largely the perception that telehealth was a very good way in which for patients and providers to interact. So in conclusion, telehealth acceptance was not primarily influenced as we thought it might be by social determinants of health, but rather that telehealth was the view that technology is favorable, and prior experience with Skype or video conferencing, so the digital health literacy of the parent may have been more of a predictor of acceptance of telehealth. Thank you.